We are very eager to share this video abstract about our narrative review titled Clinical Toxicology of Over-the-Counter Cough and Cold Pediatric Medications. In this narrative review, we highlighted the importance of clinical toxicology in evaluating the safety and toxicity profile of OTC medications for treating cough and cold symptoms in pediatric patients. Cough and cold symptoms, commonly characterized by nasal congestion, coughing, and throat discomfort, are prevalent pediatric conditions causing parents and caregivers to choose OTC medications as the solution. However, OTC cough and cold medications often contain combination of multiple active ingredients such as antihistamines, decongestants, antitussives, expectorants, and analgesics antipyretics, as well as several excipients, which increase the risk of adverse effects and unintentional overdoses, especially in pediatric patients. In this review, we explained the pharmacology, clinical features, adverse effects, pharmacokinetics, pharmacodynamics, as well as toxicokinetics and toxicodynamics profile of active pharmaceutical ingredients commonly used in OTC cough and cold medications, emphasizing on acetaminophen, pseudoephedrine, dextromethorphan, and chlorpheniramine maleate. We added some tables that can help the readers understand the context more easily. We also presented 2 case reports to provide a real-world example of adverse effects experienced by a child from OTC cough and cold medications. From this review, we concluded that the risk and severity of toxicity of OTC cough and cold medications in pediatric patients are influenced by several factors, such as the quantity ingested, duration of exposure, patient-specific characteristics such as age, weight, and genetic factors, and interaction with other substances. Therefore, to minimize toxicity risks, it is advisable to use single-agent medications instead of combination products and use calibrated dispensing instruments. Healthcare professionals should also educate parents and caregivers about proper medication use and provide clear dosing instructions. We encourage post-marketing surveillance as it is essential for monitoring potential adverse effects that may not be apparent during initial evaluations. Finally, future research should focus on the development of safer formulations and alternative treatment approaches as it can enhance the care and outcomes for children experiencing cough and cold symptoms.